Women who have recently gone through breast cancer treatments may look at reconstruction surgery after having a mastectomy. There are a few different options, and the procedure is not the same for everyone.
Yeah, so joining us now to help answer some of those questions is board-certified plastic surgeon Dr. Alexis Parcells. Thank you for joining us.
Thanks so much for having me, ladies. Good to be here.
So, doctor, can we just begin by kind of describing what is breast reconstruction surgery?
Sure. Breast reconstruction surgery encompasses a whole wide variety of procedures. The two major types are implant-based reconstructions or flat-based reconstructions, in which we use tissue from your own body to rebuild a breast. And the goal, of course, is either to restore your breast shape or to help form a new breast shape.
So if somebody decides that they're going to go that route, when would the surgery typically happen?
Great question. So oftentimes we'll do reconstructive surgery immediately, meaning that we meet the patient prior to their mastectomy or their lumpectomy, and we'll work with the breast surgeon at that time of their cancer procedure. That's immediate reconstruction. The other option is to do it in a delayed manner after they've completed, if they require chemotherapy or radiation, if they're not sure that they want to have reconstruction right away, or if they have any health conditions that preclude them from having reconstruction immediately, then we can consider that in a delayed manner.
So, Dr. Parcells, can anyone get this surgery, or are there some people that should avoid this procedure?
So, nationally speaking, only 40% of women elect to have breast reconstruction. And for some women, it's a personal choice. They just don't want to have reconstruction. For others, they just may not be a candidate at that time of their cancer diagnosis. For our patients who smoke, we recommend that you stop smoking for several weeks before and after surgery to reduce the risk of any wound healing complications. If you have diabetes and your numbers aren't where they should be, trying to get that under control, or multiple medical conditions would preclude you from an immediate option. But down the line, there's always a chance to have it done in a delayed fashion if your health improves.
So let me ask you something. What are some of the risks that women need to know about before deciding on something like this?
You know, I always say to my patients, it's a partnership. So you have to come in, and I always recommend people meet with a few different plastic surgeons to get the gist of everybody's personality and who you really feel like you can partner with. Most reconstructions will take multiple procedures, and they're spaced several months apart. So you really want to feel comfortable with your doctor, comfortable with the office, and feel like there's a nice bond, a lot of trust in the process.
Sure.
It's always helpful to make sure you're seeing a board-certified plastic surgeon, see before and after photos, ask to speak to a patient who's recently had a procedure done in the practice. Oftentimes they'll shed insights that I myself or that my staff can't answer for them. And read patient reviews. These days, everything's on Google, so you can get a lot of information there as well.
So if someone is actually considering this, what are some other questions that they should be asking the surgeon?
I think they should be asking, you know, where is this procedure going to be done? What is the post-operative protocol going to entail? How long am I going to be out of work or out of my usual activity? What are the risks associated with this procedure? And, you know, these are my goals, and do they align with your goals as a plastic surgeon? Are we on the same page in terms of what we're hoping to achieve together?
So let me ask you a question, because this is the next one that's always going to come to mind. What does it typically cost, and where is it covered in terms of insurance?
Yeah, so that's a very common question. So in 1998, the Women's Health and Cancer Act was passed, and so that mandates that insurance companies have to cover reconstruction related to mastectomy and lumpectomy, whether it's done immediately or in a delayed fashion. But I say to my patients, you should still know what your insurance benefits include. If you're going to be responsible for copays and deductibles, talk to the hospital or the surgery centers to make sure that you are not going to be getting any unseen costs popping up after the procedure, so that you're prepared on the front end.
Let me ask you real fast. It was elective surgery before that, correct?
Yes, breast reconstruction is elective surgery. It's not life-saving surgery. That's, that's you know, oncologic surgery. Absolutely.
Got it. Okay.
So, Dr. Parcells, what is the recovery like, and does it differ depending on which procedure you get done?
Absolutely. And especially during COVID, we were really able to streamline the process with our patients. So we've gotten much more sophisticated in the types of pain blocks that we've been doing. Patients have been recovering a lot faster, needing a lot less narcotics, and getting out of the hospital faster. But if you're looking at a flap procedure, you may need to be monitored in the hospital for a few days in order to make sure that that tissue is hooked up and functioning correctly. implant reconstruction often is the same day procedure. You can go home that same day.
Dr. Parcells, thanks so much for joining us this afternoon to talk about this.
Thanks so much for having me, ladies. It's great seeing you.
All right, you too. And for more information on this topic, Dr. Parcells has a website dedicated to women with breast cancer. It is loaded with information for survivors. Just visit bravebras.org, or you can follow them as well on Instagram at bravebras.